its core, supportive housing is looking to um, connect someone with a unit of housing that they can afford, right? And then offer a range of support to walk alongside that individual as they continue to stably reside in housing and achieve other goals that they may have set for themselves. Also, making sure that folks have access to all of the other supports that they might want to take advantage of, like mental health or substance use support, right? Employment or income support.
Supportive housing and housing with wraparound supports is a solution, and that we can't just build shelter until everybody's in shelter because they're not housed. That's not a permanent place for them to be.
Probably unsurprising to most of you, when people have housing, they have increased and improved access to other form of cares that are vital to our human survival. And beyond just, improved access to health or transportation or food services, tenants also express things that I didn't even think about right off the bat. So some of those things include trauma-informed medical support. Some tenants even mentioned family support and unification, as well as just the ability to obtain, higher education. Many other facets of our multidimensional lives that are oftentimes reduced when people are experiencing homelessness.
The two organizations sponsoring this event, the National Alliance to End Homelessness and the Corporation for Supportive Housing, we worked together on a series of community conversations that we held.
In this focus group, we talked about what's working and what's not working. And so my peers said things like, we need more green life skills in supportive housing, of creating an unbiased culture of sensitivity. You got to work with lived experience, especially if we live on the property.
One thing that leapt out to us is that there just isn't enough supportive housing to meet the need. When we're not solving the challenges due to a lack of resources, we see more and more people using inappropriate responses within communities like law enforcement as a crisis response, when people would be much better served by having behavioral health professionals.
So, increasing or sustaining funding for services and operations is a critically important way to help bolster, sustain, scale supportive housing.
Generally, we're a community that was struggling with the idea of housing first because we were unable to operate it to fidelity. Folks would see folks go into units and not have sufficient services and then go back out onto the street. When Housing to Recovery began and we brought on our first projects, we were really able to demonstrate what Housing First could be. Many of our programs have more than a 95% success rate. Over the years, Housing to Recovery Fund, as a public-private partnership, has repositioned supportive housing in our community and allowed our community to say that it's possible for anyone to be housed without precondition. It just means that the approach that the case manager and the organization can take in serving folks is already centered in what the person needs as opposed to what can we bill.
Partnering with community. So I've introduced a lot of clients that had challenges to what's going on in the community, expanding their horizons, um, talking about the deep hurt, holding space. This is just me and some of my peers, what we've done, and we've seen breakthroughs.